Okay, we're going to go ahead and get started. Welcome everyone to Chicago Check's virtual community conversation on making the most of your telehealth experience during the pandemic. I'm going to go ahead and share my slides. Okay, so thank you so much for joining today's conversation. We look forward to hearing from everyone regarding your experiences with telemedicine or telehealth during this call. We have a really great expert on the call who will be available to answer any questions that you might have. My name is Melissa Martinez, and I'm the UIC Outreach Core Manager for Chicago Check. This event is brought to you by the Chicago Cancer Health Equity Collaborative, also known as Chicago Check, which is an NIH grant partnership between Northwestern University, Northeastern Illinois University, the University of Illinois at Chicago, and various community partners. We aim to support cancer health equity in Chicago through research training, research education, and community engagement. And I want to give a special thank you to the Mile Square Health Center at UI Health for collaborating with us in today's conversation. Their mission is to provide holistic quality health services in the midst of an underserved urban community. And then before we get started, I also quickly want to mention that we will be having a community conversation in December. So this will take place Wednesday, December 16th, also from 12 to 1 p.m. And the topic for this will be a conversation with community-based organizations to identify resource needs for community members during this time, in preparation for a resource fair that we will be having in February. So we'll have more details to come for that one. So for today's conversation, please keep your microphone muted while others are talking during the discussion portion of the event. If you do have any questions, feel free to post them in the chat, and we will try to get through all of them. And so now I would like to give a warm welcome to our expert on the call today, Dr. Nicole Gastala. She is the Director of Behavioral Health and Addiction at UI Health Mile Square Health Centers in the Department of Family Medicine. So thank you so much for being with us, Dr. Gastala. So I will go ahead and share your presentation.
Great. Well, thank you, everyone, and thanks for joining. This talk sort of comes at a really important time, right, where we're seeing increase in COVID cases again. And so the question may be coming to your mind, should I be going to the doctor in person, or should I be engaging in care via telehealth? So we just kind of wanted to go through like what exactly is telehealth, as well as how you can maximize the visit to help improve care. So again, I work at Mile Square Health Center, which is an FQHC system that's part of UI Health. I'm a family doc who also is board certified in addiction medicine, and then the director of a behavioral health team that includes clinical psychologists, psych APNs, LCSWs as well. And we've moved a lot of some of our care to the telehealth platform to help decrease our exposure for patients when they're coming in from the community, especially for some of those visits that it works out really well to have telehealth as part of. Next slide. So what is telehealth? So this uses electronic information as well as telecommunication to help extend care to you from when the doctor and you aren't in the same place at the same time. So this can be done via phone or a device with internet, and you usually tend to have everything you need to do telehealth. So you can talk to your doctor live over the phone or potentially video chat. You can send and receive messages using chat messaging, email secure messaging, and secure file exchanges, as well as use remote patient monitoring. And this, for example, could be if you have a home blood pressure cuff, if you're checking your blood glucoses, if you have diabetes, if you have been diagnosed with COVID and you're doing home monitoring, they may have sent you home with your own little pulse ox that you put on your finger that checks your oxygen level, and they may ask you that at your appointments as well. And so this is a way to sort of help keep your doctor updated during your visit. So it's really important that because recent federal policy changes have allowed us to be able to expand telehealth substantially, including using platforms that may be easier to use and that patients are already familiar with. And this can be Apple FaceTime, Facebook Messenger video chat, Google Hangouts, video, Zoom, or Skype. So you can sort of ask your doctor which one they prefer, or you can let them know which one you prefer if you feel more comfortable and they're able to accommodate you. So what type of care can you receive via telehealth? Well, you can do general care like wellness visits, and you're probably like, well, how is that possible? Well, if you don't need any labs, you can do quite a bit through that. Or if you don't want to come in for the whole visit and just come in for a lab only or vaccination only, which means you're in and out in 5 minutes, you don't have to wait long in the waiting room or anything like that, I can see you for your general health care and then put in orders, and then you can come in for a lab only visit, especially during low volume times. If you need a refill for your prescription, say you've got hypertension, high blood pressure, and you need a refill and you're supposed to get your, every 3 months checked up, you can actually have your blood pressure cuff at home, check your blood pressure, let your doctor know, have your visit via telehealth, and then they can continue prescribing. Dermatology is another one. So if you've got video capabilities, then you can show a doctor a rash, right? Or something like that. Some ophthalmologists have the capability to do eye exams. You can do nutritional counseling as well as mental health counseling, as long as you've got a safe and secure location at home. A lot of counseling and mental health services can be done via phone or video chat. Urgent conditions such as sinusitis, back pain, UTI, common rashes, some of these can also be done via video visits. And then really importantly is COVID-19 follow-up. If you end up getting COVID during this time, it's important to check in with your doctor for a telehealth visit every few days just to make sure you're doing okay, if that's a service that they offer or one that you can request. So how do you maximize this experience? Well, you'll need a smartphone or device with internet connection and audio, video capabilities like a tablet or computer. If you're using video to talk with a doctor, there are a few things you can do ahead of time to help the visit run smoothly. Choose a spot with plenty of light. If you're using the camera on your phone, turn off the flash. Make sure the camera is steady. This will be easier if you're using a computer or a laptop. To keep a phone steady, you can prop it up on a desk. So this is if you're going to do a video visit. If you're doing a phone visit, then all you need to do is make sure that you've got good access to your phone at that time. For the video visit, get comfortable. You have an easier time focusing on the visit if your body is comfortable. Another reason to have your phone propped up, right? Because your arm will get tired if you're holding it the whole time. Wear loose clothing so that you can show the doctor something on your skin or a specific part of your body. Wear something that'll be easy to move so that the doctor can clearly see. Reduce any background noise. This can be really hard if there's a lot of people in your house or kids or roommates. Try to go into a separate room if possible. And close other applications. If you have a lot of things open on your phone or your computer, that can slow down your internet connection. And even if they don't, closing them will cut down on distractions, which is really important. All right. So this is telehealth.hhs.gov is where I got the majority of my slides. If you have any specific, there's really some great like videos and recommendations on how to improve your visit. Writing down your questions for the doctor in advance can be really helpful too. And making sure you have, if there's any documentation that they wanted, like blood pressure or glucose readings, that you have that done sort of have that written down in advance for them. And then thinking about how you would like to do follow-up if you need labs or anything in person. So thank you so much. I know that was short and sweet, but I wanted to make sure we had enough time for questions or anything that you had any thoughts about telehealth.
Thank you so much, Dr. Costala. So now we're going to go ahead and open the floor for everyone to speak or ask questions. So do we have any questions from the audience?
Hi, this is Alicia. So I had one question. What are some common challenges or barriers you've noticed with moving to a telehealth visits during the pandemic?
I think getting one of the challenges initially was getting the providers used to it and sort of seeing and being creative on what we can and cannot do. That's from the provider standpoint. From the patient standpoint, I think the biggest challenge is, sort of differentiating in your mind about what you would want the doctor to see versus what you can just talk about. So, what should be done via video versus what should be done via phone. Um, and then getting sort of, yeah, those questions in advance. Getting the schedulers to get used to that as well is also, an important sort of transition. And telehealth was kind of done before COVID, but really all systems had to move to it very quickly. So there's very few things that I think are silver linings in all this, but this may be one of them because it does decrease transportation barriers for patients. It can also have patients who work, right? They can then schedule their telehealth with me during their lunch break. And so then they don't have to miss a long day of, a half day of work or whatever it may be to travel out here, get checked in, sit in the waiting room, get pulled back. And, there's delays sometimes, right? So then they can get scheduled they just talk to their supervisor, say, I'm going to take my 30-minute lunch break whenever my doc calls. I call, and then they're able to do their appointment then. So that's been, I think, really, really helpful for people who can't miss work. To be able to still access care. But it does take a little bit of a transition for the health system as well as patients to sort of think about doing telehealth.
Thank you. It does look like we do have a question in the chat regarding, how has this been working? How's the availability of telehealth when it comes to including an interpreter on the call?
Yeah, that's a great question. So we have at U of I, we do have interpreters. So what we do is we call the interpreter line, let them know, and then we reach out and do sort of a three-way call together. And then just sort of like in a video visit or in a visit where the patient and the interpreter is in the room, we're just all joined via telephone.
Thank you.
We do have another question. So this is kind of a long one, questions within a question. So are people actually attending follow-up visits, screenings, etc. during COVID-19? And have you noticed any drops from particular populations?
Yeah, I mean, I think that that's been one of the biggest challenges is what is all of the consequences of this, of COVID, right? Not just the COVID itself, but all of the access challenges, right? So putting off mammogram screenings, what does that do to patients? Does that impact and really impact cancer screening, right? And making sure that we are screening mammograms dropped off significantly because people were afraid to come in. And I think that we have, although the spread is high in the community, we know a lot more than we did before, right? In March, we know how COVID's transmitted. We know how to protect ourselves. We know how to protect our patients. We have good cleaning protocols and screening protocols. So it is safe to come into health centers to get your screening done, to get your mammograms and colonoscopies and all of the things that are necessary in terms of preventative health and screening. So I think it's also important that we talk to patients and community members about that, because it may not be a good idea to put off their screening if we know that the medical facilities are safer. Now, of course, that doesn't change, or that makes it challenging, though the COVID spread in the community is high, right? So if patients are taking public transportation and have all of those challenges, they do increase their exposure on their way here and on their way home, which of course is a problem. But then working with your insurance company to see, do you qualify for a ride? For if you've got Medicaid or one of the MCOs, perhaps you qualify for a ride. Or would it be a good idea, to consider a lift or something like that at that point, where you both are masked and there's, appropriate distance in between. So I do see that that is a big challenge. And as I said, the cancer screening rates have dropped, which is a big problem, especially if patients are high risk or they have symptoms, right, of any, condition that does need to be screened or diagnosed. And we're going to continue to see those unintended consequences, I think, over the next year or two. So I think that's a very important message to have.
Great, thank you. And then another question that might go along with this, that someone has: do you have tips to help people determine what are minimum or mild symptoms versus symptoms that might require an immediate or in-person attention?
So I think that's a really good question. You can always schedule a telehealth appointment initially with your provider, and try to get that within a few days, for whatever symptom you may be having, unless of course it's emergent, then you always go to the ER. And then your provider will tell you, like, no, I really think you should come in, and then they'll schedule you an in-person visit. So you can always do telehealth first, and then the provider, once you describe everything, they'll let you know if they think that you should come in for a lab visit, or if they think you should come in person to be evaluated and have a physical exam as part of that. That's a really good question.
Okay, thank you. And so this is more, I guess, of the logistical aspect of it. So how can someone request or set up a virtual appointment? So does the patient first need to meet with a provider in person and then set up the virtual appointment? Or can you tell us a little bit more about how that might work?
Sure. So you should be able to call the call center or office directly and ask for a telehealth visit, and then they should accommodate you. Most systems do not require an in-person visit first, so you can go directly to a telehealth visit.
Okay.
And then we did have some questions in the chat that kind of are going along with the previous questions. So the one question we had was, what conditions can be treated through telehealth visits? Are telehealth visits billed at the same rate as in-person visits?
Sure. So a lot of things can be done. So like hypertension follow-up, again, if the patient has a home blood pressure cuff, you can do lab follow-up visit, you can do a wellness and go through their whole history and then decide if you need to get labs after. You can do sort of anything that doesn't require a physical exam or like physical like testing, right? Like a pap smear or something like that would require you to, come in. But you can always have the telehealth appointment first and then, get scheduled for the in-person if needed after that. And then our telehealth visits billed at the same rate as in-person visit. That completely depends on the insurance company and the rules and regulations. So as a federally qualified health center, we get the same reimbursement rate, whether we bill a level 2 or level 5, whether I spend 15 minutes or 5 hours with a patient, we get the same rate no matter what. Also, whether we do in-person or video, we get the same rate. So we just get sort of flat fees for patients. So it really just depends on the hospital, the clinic, and the different, what contract they have with the different insurances, which can be very broad, right? Especially if you talk about all of the MCOs, the Medicaids, also Medicare, right? Tons of Medicare plans, tons of private plans as well. And then I see some more questions. How do you foresee that landscape of telehealth visits after the pandemic is over? Will they be more widely available for certain kinds of visits, such as the ones you mentioned? I think so. As long as the insurance companies continue to reimburse the same or close to equivalent, then I think for, visits like mental health or just quick check-ins or medication follow-up, they can be really helpful for patients, especially if it doesn't, then it won't impact their work day or, whatever, or transportation barriers or several of those other things we talked about. So I do think as long as the reimbursement model continues, then it will be, we will be able to do that. The challenge is if insurance companies go back to not paying for it, then everyone would have to move back because you wouldn't be able to afford to do that.
And I do see that we have a hand raised in the audience. If you wanted to unmute yourself and ask a question, you're more than welcome to.
Yes, I do have a question. During a telehealth visit, is it possible for the doctor to diagnose me without actually doing a physical exam?
Yeah. So there's several things that we can do without a physical exam. Certain things are pretty classic, like a urinary tract infection. Sinusitis was one of them. That's pretty common. If you have a rash, that's sort of easy to look at. Other things can be a little bit harder, right? Knee pain can be a little bit harder to evaluate depending on the mechanism. But a lot of things can be figured out through the history and just talking to a patient. The physical exam is not always as necessary as people may think it is. And so it really just depends on the question that you have or the health condition you have. Again, for follow-up appointments like blood pressure, checks or diabetes checks, as long as you're telling me your glucoses or your blood pressure readings at home, most of it's just medication adjustment or checking in and making sure you're doing okay, talking to you about diet and exercise and all of those things. So it's really only for certain things that you need a physical exam for. And again, the doctor can also tell you after that visit that, hey, I do need to see you in person for that because I need to do an exam or we need to do some testing. I won't be able to figure it out without doing those things.
All right, thank you very much.
Yep.
Thank you. That was a great question. So we also have another question. So sometimes it can be difficult for people to communicate their symptoms or maybe put into words the kinds of things that they're feeling. So in this case, do you have any tips or what suggestions would you have for people who might not be able to communicate what their symptoms are without being physically assessed?
Yeah, again, most of what we do is really via talking with patients, getting the full history. We'll ask you a lot of questions, right? If you say, well, I've got this kind of weird belly pain, it's really hard to describe, then I'm going to ask you a lot of questions, right? So we go into, well, when did it start? How did it feel when it started? How did it change? Did it make anything make it better? Did anything make it worse? Does it wake you up at night? How's your bowels? Any nausea, vomiting, diarrhea, any fevers? We're trained to ask a lot of questions, really to specifically get at a particular diagnosis or differential of diagnoses. So even if you're just like very vague and just say, I'm just not generally feeling well, and then I would go on and say, okay, right now, does anything particularly hurt on you, right? And then, just asking subsequent questions and helps me get at what's going on. Because again, the physical exam may or may not be helpful at all. If you say, well, my stomach pain comes and goes, and I say, are you feeling anything right now? And you say, no, when I do your exam, it's unlikely I'm going to find anything just by pushing on your belly if you're not currently having pain, right? So I think there's a lot you can get at.
Okay, thank you. Do we have any more questions from the audience?
And to add, even if, anyone has any experiences or, situations that they've gone through that they'd like to share with the group, we can even have a conversation that's sharing some experiences that folks have been going through. So I did have another question, and I think that you maybe alluded a little bit to this earlier too, but are there any like recommendations that folks that you can give to folks to ensure that their telehealth visit goes smooth as possible? If there's anything that maybe some of your patients have done to prepare for their telehealth visit that's been beneficial for them?
So it depends on whether it's video or just phone. If it's video, making sure all of your apps are gone, you're in a quiet area, you've got good lighting, and sort of again wear those loose clothing. So if there's anything you want to show me, it'll be easy for you to do. If it's just a telephone, just making sure that you have access to your phone and you've got a quiet space that you can talk in. And don't be surprised if your physician still runs late because rarely are we ever on time, not because we don't want to be, but just because of a lot of the ways that insurances structure our reimbursement is we get overscheduled and double booked quite a bit. And that just has to do with access for patients. And so don't be surprised if your doctor still calls you maybe 30 minutes late. They're going to do their best to call on time, but sort of make sure to block yourself a little bit of window of time, a buffer, so that again, if you're at my 12 p.m. appointment and I started at 8, I'm probably going to be running 15 to 30 minutes behind because things come up. Some patients may be really quick and fast. Other patients are really sick, and then they take more time. And a lot of us are now doing combination in-person and telehealth. So you can imagine running back and forth between my office to do telehealth and then doing a couple in-person and then back to my office to do telehealth. There's a little bit of delay there too. So patience is, sort of really appreciated during this time too.
Thank you. And we did have another question in the chat. Is there any data to show how many people are doing office visits versus telehealth?
Yeah, so we actually track that on a daily basis. And when COVID was really bad, or I guess when we didn't know that much about it yet, and we had blocked all of, a lot of clinics or closed them, it was like 90% at its peak was telehealth. Now we're at our center, we're more about maybe 70% in person, 30% telehealth.
And then we do have another, thank you, Maggie or Magdalena Nava, for sharing a little bit more about your dad's experience. So Maggie said, my dad gets asked to take his own blood pressure reading before his telehealth visit. I found this to be bothersome as I don't know how accurate some of these numbers are. Is there something that as caretakers, we should be on the lookout to assure accuracy of these numbers?
That's a great question. You can always bring in your blood pressure cuff to your doctor's office. And when you come in for an in-person appointment, and then we use your blood pressure cuff and then we use ours and then compare. So that's sort of what I always recommend, doing. You can also take it to the pharmacy too, where they got it from, and see if they can, do a quality check on it. But the best thing is to bring it in when you're coming into the office. Or a lot of times pharmacies also have like that blood pressure machine. So I don't know if they're open right now, where you can get your blood pressure checked there. And you can also do that and then compare it to your own cuff. So that's something that can be done.
And then we did have a follow-up question to when we were talking about data. So right before the question we just addressed, but are the patients typically younger like younger patients? Excuse me.
No, actually, it's actually a lot of our older patients who don't want to, who prefer to do telehealth right now because of, they're nervous. And so I would say it's pretty mixed, but the majority of my telehealth right now are either working patients or older.
And then just to follow up a little bit about that, I know that some people might have a harder time using technology or smartphones and navigating through different applications, especially if they seem newer, applications that they haven't used in the past. So are there resources to help people who may not be tech savvy navigate through telehealth applications or telemedicine?
Sure. So I don't know if there's specific like outreach, but usually the clinic that you go to should be helping you through that. So if you've got an appointment and they're calling you to confirm it, you can say, okay, can you help me like figure out how to use this? Can you connect me to a nurse or someone from my care team who can walk me through how to do this and test it?
Okay, great. Yeah, I know during our community forum, we sort of introduced and started talking about this topic, and we did have a community member share her experience, and she mentioned that she had to help her brother navigate through telehealth because he wasn't very tech savvy, and she mentioned that um, that if she hadn't helped him, she wasn't sure that he would have been able to navigate that on his own. So just kind of going back to that question, have you noticed these kinds of things to be a challenge for many people, and what are some ways that that maybe people have done to kind of address these barriers?
Sure. So I think calling ahead of time and talking to the care team and asking them to walk you through and do a practice run is really important. So asking for help, I think would be, because each clinic's going to have maybe a different platform. So, just finding a resource online may not be enough. You may have to talk to the actual clinic itself. And then worst case scenario, you convert if it doesn't work for you or your internet's not strong enough or whatever it may be, you can convert the visit to a telephone visit.
Okay, great.
Please ask
Yeah,
to do that.
I I didn't know that. So people are able to schedule like a practice run or trial run beforehand. Okay, that's great. Any other questions or any stories or any experience that anyone might want to share?
This is Beverly. I have a question. Thank you, Dr. Costello. My question is, how does your center kind of keep track of people patients who don't want to come in and really don't want to have a telehealth, in keeping up with their care and just having them, reminding them of I would call them maybe lost to follow up since the COVID pandemic, based on, issues with challenges using telehealth in general, or trying to come into the clinic.
Yeah, we follow up with a lot of patients via phone, actually. A lot of our telehealth is actually telephone visits because of that reason. We have registries, so we try to check to see if anyone's late on their diabetes care or their other preventative health, but it's not perfect. And that is one of the challenges. And I think something that we all need to be really aware of, clinics and patients, is that COVID is a risk. That is absolutely 100%. But we also need to make sure that patients aren't um, having their diabetes not controlled, excessive blood pressure, not doing their cancer screenings and all these things, because those are all can be significant unintended consequences. So we really need to reach out, and patients need to reach out too. But it is definitely not a perfect system right now. I think just from a public health standpoint, there's going to be the number of deaths and illnesses from COVID directly, and then also the secondary, right, from lack of access to care, or not accessing care, or I mean, the hospitals are full now again. It's a problem.
Thank you so much. I do have another question. How do you do or handle with maybe compliance after telehealth visits? I know generally compliance is generally an issue, but do you feel like they will be having more compliance issues based on people that are doing more telehealth than those coming in?
I don't really see that much of a difference. I actually see better follow-up for the telehealth because, again, we've reduced that barrier, especially for chronic patients with chronic disease, because then I can check in with them more frequently, or the ones who are having a hard time coming in because of transportation barriers. Whether a patient chooses or chooses not to, take their medication or follow recommendations, I think is independent of telehealth. Whether I'm in person or via telehealth, they may still do the same thing. And that's okay. Like that's part of their rights too. I don't see necessarily a drastic difference. Like me seeing someone in person is gonna for sure make them take their diabetes medicine versus me telling them that over the phone. That has more to do with like all of the other things in life, right? That may be impacting that patient's decision to take their medication or not, including social determinant of health barriers, um, concerns about medication management, all the other things in their life that may be barriers, or not trusting, medications.
Thank you.
So it does look like, Carbon, you have your hand raised. You can go ahead and ask.
Yeah. This is a wild kind of a question. Do you see the homeless accessing telehealth?
Yeah, so what we do at Miles Square is work with community partners. So I do addiction medicine quite a bit, and primary care. So I work with Chicago Recovery Alliance, with Thresholds, COIP, and Night Ministry. They have van reps they go out and see patients in encampments. If they're interested in treatment, they just connect us right then and there. So it actually has, because the DEA relaxed their regulations, we've been able to treat more patients in their location, whether that's under a viaduct in an encampment or under Lower Wacker Drive, wherever they may be. That I think has improved access, as long as they have a community partner is visiting them, or they have a phone. Some of them do have government phones or phones that they have themselves. But that is something that we've been able to do.
And kind of to go off of that too, how has telehealth been working for patients with disabilities?
Yeah, I think that can be, it depends on what the disability is, right? If it's, physical, and it actually may be easier for them not to have to come into the office, right? So that in terms of getting, transportation and all those challenges, right? For other patients who may have, auditory, um, challenges, like being, needing sign language, or that would probably be a bigger challenge, or we'd need to have to do in person. We haven't really been able to do that yet, unless one of our other clinicians knows better than me regarding the different translate or services that are available.
Thank you.
That's a good question.
I do have a question that was asked in the past to me, just to confirm or clarify that these telehealth visits are documented like any other visits in your charts for continuity of care.
Correct. Yep. They're just like any other visit. It's its own encounter, billing, all of that. So my plan is in there for the next provider. Yep.
Do we have any other questions in the audience? You guys are more than welcome to unmute yourselves and share any experiences, any questions that you have. I can kind of talk for an experience that I've had with in my family. So my grandma, she's in her 80s, and she's a spitfire, and I God loves her. She's the Energizer bunny that keeps going. But one thing that we've kind of noticed, and I think she even noticed for herself, is that her hearing isn't as great as it used to be. And with telehealth visits and things like that, we were kind of able to get to a point between me and my aunts and the rest of my family that she needed to get a hearing aid so that she'd be able to. So I was even noticing it when I was on the phone with her, that she was like, I can't hear you, but I'm going to get a hearing aid and I will be able to hear you. It'll be fine. And oh, I love her, the way that she was like, I can't hear you, but it's okay. But I think that was one thing that we were able to kind of be more aware of, because we were doing more of these, communicating over the phones. And I'm sure that it was something that was brought up during one of her telehealth visits with her doctor as well. So that was just a little story I wanted to share, because I know that was something my family had experienced.
Thank you, Alicia, for sharing that. That kind of reminded me another very important piece that I've heard in the past about privacy surrounding telehealth. How do we retain that privacy? I know certain software can help, but when I hear that conversations surrounding health is done through the phone and through people's various service providers, how is what is it called? How is people's privacy retained or protected?
Yeah, and I think that's so Doximity is a HIPAA compliant software. The telephone, as long as there's no one around, that one is also safe. But it just depends on if the patient has other people in their house that they don't want to hear. So like if you've got a domestic violence situation, this would not be the place that you'd want to do therapy, right? Like you wouldn't want to do it from their home. So it really just depends on the patient and the location. The There are of course, HIPAA compliant mechanisms to use, such as like FaceTime and things like that, that people are using because it's easier. There's not 100% protectiveness, but during this COVID-19 crisis, it is allowable, from the regulatory standpoint.
Hi, yeah, I had a question. My name is Edgardo, and I also work for the Chicago Check team. Thank you so much for this amazing information, Dr. Gastala. But I had a question about, any considerations that you've either noticed within your team or outside in general within your work about any types of like mental health screenings that patients receive who have been hospitalized from COVID and since then recovered. So like an example, my father actually, this was the case for him back in May, and he was exhibiting a lot of PTSD-like symptoms. So he was having a lot of anxiety and difficulty sleeping. And I'm in Chicago, my family's in Iowa, and during that time, it was, they were doing a lot of the follow-up visits after he got discharged via phone. And due to, I think what was a language barrier, and also what you see sometimes in in the Latino community, but also I would argue like Latino men specifically, sometimes a little bit of the downplaying of symptoms, or really not recognizing what they are, or just describing them a little differently than typical patients. The doctor basically didn't, his PCP didn't really get a sense of how bad his anxiety was. So it actually took for me to arrange a follow-up call with him to just kind of walk him through a few examples. Like he was getting like shortness of breath by like being in the bathroom, because that's where he first felt shortness of breath before he got hospitalized. But he also wasn't sleeping for a good 3 to 4 days. And so there was just like a lot of, he was constantly being triggered. And so I kind of had to provide more examples. So I guess I was just, I guess to end all that, I just wanted to know like what types of strategies or, questions you ask for these types of patients.
Sure. So it really depends on your clinic's protocol. So ours, we use a PHQ-2, which then triggers the PHQ-9, but that's of course doesn't check for PTSD, right? So you would need like the PCL5, I think, is one of the screening tools, which then if you're suspicion, then that would trigger it. I think it's hard in general to identify trauma and depression and anxiety or mental illness in patients until you know them for a while, if they're on the quieter side about it, or unless you directly ask questions. So I think that's something that as clinicians, we always should get better at. But sometimes patients just don't feel comfortable yet sharing that information because they may not feel ready to share it unless you directly ask, or it may not be, they may not feel like it's socially acceptable, right? Like depending on within, different cultural communities. It's so much of the time you hear, well, I just need to be, I shouldn't be scared or, stressed or upset. I just need to be stronger, right? Like there's this perception that like a strength of personality is like consequential when it comes to, addiction or behavioral health. And so part of that, I think, is breaking down some of those societal expectations and cultural expectations that that's what that's supposed to be, because it's not a failure on anyone's part. We're all human. We all have these feelings. And some of us go through extraordinary traumas and don't necessarily share them, but the impact, right? Which is why ACEs is so important in kids and can impact care later, but also screening in adults. So most COVID protocols right now really just screen for their symptoms, right? It doesn't screen for depression or trauma or anxiety or insomnia or some of these other things, just like in any sort of other health exam. So unless a patient brings it up, it's really hard. But I think it's also maybe doing more education for providers to ask more pointed questions like, hey, that was really hard what you went through. How are you feeling now? How are you sleeping? How are your relationships, right? How are you dealing with all of this? Like, that was really pretty scary. Especially if he was hospitalized and intubated. ICU PTSD is like very known, and now we're adding a secondary layer of trauma on that with COVID, plus the potential of if he had any friends or family who died, right? Where we are seeing an unprecedented amount of that right now, of death, and disproportionately affecting our Black and Brown communities, especially in Chicago. And what do you do when a mother of 4 survives, but her partner does not, right? And that happens a lot. There's a lot of trauma right now around that. It's almost like September 11th level of trauma that we're getting.
No, thank you so much for
Yeah,
that.
I don't have a great solution.
No, I don't think there is a perfect answer for it, is the thing. Like, I actually had a really great conversation with this PCP about it. And he mentioned the exact same thing, that he was seeing a lot of, PTSD-like symptoms in his patients. And so, we had a nice conversation about that. And ultimately, my dad ended up getting prescribed some anti-anxiety meds that helped him sleep better. And, some of it was also, on our family side, just kind of having those conversations with him, letting him know that it's okay to like recognize those feelings, and that like if they are impacting his ability to like sleep and stuff, then that's important. It's important to address that. And so that was, we had some good conversations as a result of that. But I do agree that on the provider side there, there's always work to be done there too. And asking more in-depth questions like the ones that you asked, I think are great. So I want to thank you, for taking that approach, because I really do think that it's really important in communities of color, especially.
100% agree.
Yeah, thank you so much, Edgardo, for sharing that story and your experience with your family. We do have about 3 minutes left. So I just quickly wanted to ask if there are any other questions, or if anyone else has any experience that they would like to share before we wrap things up. Okay, thank you so much, Dr. Costala, for being with us today and for answering all of our questions. So a recording of our discussion today will be available soon, and we'll be sending that out, and we'll also send out the link to telehealth.hhs.gov that Dr. Costala shared with us today. And if you guys think of any questions that you may not have thought of right now, you're welcome to email those questions too, and we can try to get those answered for you as well. But thank you, Dr. Costala. Thank you, everyone, for your participation. It was a really great discussion. And we really appreciate you joining us today.
Have a great day, everyone. Bye.
Thank you. Take care.
Thanks. Bye.
Thank you.